Now let's just go through what are the questions that we are going to ask to come to this diagnosis. So the one mnemonic that we remember very well is for pain, OFDPP, LICRA. So I am just going to modify that mnemonic very slightly. The mnemonic for constipation or diarrhea. It's mostly for diarrhea, guys. So okay. OFDPP. Onset, frequency, duration, previous episodes and progressions, they are the same. Then we are talking about LICRA, right? So instead of L, we use C. Okay, C, I, and Q. Okay, so in C, I, and Q, we ask the context. Just a second. So C is for context. It's for color. And from O you have odor. Okay, so context can be food, in relation to food. Intensity is volume. This is nothing but volume. And Q is for quality. That means the stool, is it watery, or is it mucus, or does it have fat, which means it's pancreatitis. So how do we ask this question is, do your stools float on water? This is the question we ask. And then you have blood. So when it comes to blood, we ask the amount of blood and when does it occur. So does it occur before, after, or mixed with stools? And is it frank blood? And now we don't have anything in radiation. But let's talk about associated symptoms. Associated symptoms. A and A are, this is aggravating or relieving. Aggravating or relieving features. And associated symptoms. Let's just follow the mnemonic which we've been following for abdominal pain as well, so that it's easy for us to remember. So that is F, I, T, S. So there is stool. So do you have any urinary complaints? And then F for fever. We have to remember fever. This is important here. And then nausea and vomiting. So food, it goes down as stool and it comes out as nausea and vomiting. This is the mnemonic. So let's expand this now. So do you have your bowel movement in relationship with food? Is there any relationship between your bowel movement and food? If yes, then what type of foods? You can skip this question here. I am just telling it for the sake of memory. And then, have you eaten outside? E is for exposure. Have you been exposed to anyone with similar complaints? Or have you been diagnosed with any such symptoms before? Okay. And then T, have you traveled recently? You can even ask trauma here, but that's not that important here. And then in the previous mnemonic, it stood for taste. Any change in taste. You can even ask about burning in your chest or dyspepsia. This is just to rule out gastritis that can present as melena. or peptic ulcer disease. Then we have stool. Stool is nothing but you've already covered it over here. OFDP LICRA. This is what we have covered. Now, let's expand this part. So along with fever, we also asked, do you have rash or joint pains? Then remember Crohn's. So we are going to ask ulcers in your mouth. And this is for ulcerative colitis, the joint pains. And ulcers in your mouth is for Crohn's. And then we think about the liver. So do you have any yellowing of your skin or distension? So basically this is the mnemonic that we have here. And apart from this, it's very important that you ask sleep, appetite, weight, diet, exercise, and fatigue. Okay, this is very important. Fatigue can come for pancreatitis or any cancers here. Appetite and weight changes can be for cancers. Diet, we have diverticulosis. We have diet, and even exercise also comes for diverticulosis. They have low fiber diet. And then we have lactose intolerance and celiac disease. So this mnemonic is very important. We have to ask. It becomes very important with respect to GI symptoms. Let's just quickly see the general mnemonic and any pertinent positives or negatives that we have to ask. So PAM hug FOS, right? So P, in past medical history, anything can be positive. Just ask an open-ended question and the patient will answer. Diabetes mellitus, you're looking for pancreatitis, you're looking for thyroid disorders or liver disorders or heart conditions. Remember mesenteric ischemia. So we are also thinking about that. And then there's nothing significant in allergies, but medications, yes. So have you taken any antibiotic recently? For pseudomembranous colitis. This is for pseudomembranous colitis. Or have you been taking any NSAIDs, which is for, or blood thinners? This is for bloody diarrhea, just to rule out. And NSAIDs if it is PUD or gastritis. Okay. Next, we have past medical or past surgical history, hospitalizations, H. H is for hospitalization, so PMH or PSH. So in this, we ask about abdominal surgeries, because abdominal surgeries can lead to intestinal obstruction. Next, we have history of gallstones, or or if the patient has been hospitalized for pancreatitis before. So it's just a repeat question. Then I'm going to use this one, history of infections, immobilization or immunization. This is not that significant here. And then there is history of travel, but we are not going to wait this long to ask that because it can be a pertinent positive or a pertinent negative. So under travel, I just ask an open-ended question, but for a hiking trip, or have you drunk water from a freshwater lake? This is for giardia. Traveler's diarrhea, most common parasite is giardia. And then PAM hit FOS or PAM hug FOS, and urinary and GI symptoms we are covering here in detail. And so I've used PAM hit here. Then FOS, F, family medical history. It's very important, especially in case of colorectal cancer or ulcerative colitis or Crohn's. And then you have the S's, which are very important, like I said, social history, substance, everything is important. Everything is important. Smoking, alcohol for pancreatitis, and then you have any other substance abuse. It can be opioids for constipation. Next, we have sexual history, and in sexual history, we have if we are thinking about diarrhea, then we have to ask about AIDS, viral cause of diarrhea, AIDS risk factors, and then yeah, screening is very important again. Colonoscopy, and when was your last colonoscopy? This is very important. Yes or no, and when was the last? This is the question which I always forget to ask. And what was the result? You can ask this even for alcohol and smoking and substance abuse also. When was your last drink, or when was the last time you smoked? Yes, this is important, and I can't stress enough of how important this mnemonic is again. For abdominal cases, this is very important. All right, I think this is it. I think I've covered most of it, hopefully. I hope you enjoyed this video, guys.